Okay, this is the only fancy chart I have. This is just showing the idea of the effect on primary fatigue with MS on quality of life. So if you take a look here, you'll start having some fatigue from your MS, which may reduce your activity, your physical activity, which then may also cause some deconditioning. You might also feel a little bit unclear, cloudy thinking. You can't hold your attention to a subject, you forget things as a result of fatigue. This makes it harder to fulfill these roles that we're talking about, being a parent, a partner, your work role, which then gets really frustrating and might affect your self-esteem and might then affect your mood. So all of these things trickle down to affect what we're talking about, wellness and your idea of your own quality of life. And so this is what OTs really try to focus on in the beginning to address fatigue so that these things don't trickle down to be bigger problems in the future. In terms of what's driving this focus on wellness, there's a lot of attention nationally and even internationally on focusing more on these preventative type measures as opposed to just waiting to patch up the impairments. I'm not going to go into the details of any of these reports and recommendations, but basically they're all emphasizing that we get earlier access to intervention, that we get it where it's convenient to us, whether it be in our home, at work, in the community somewhere, and that basically you as patients get more choice and control over what you're getting. Basically, a big driver in a lot of these, a common theme, is worklessness. So there's a real push to keep people in their work role as well, which is also something where OTs come in terms of role maintenance. So what are we doing to implement these recommendations? I've been fortunate enough to be invited to attend the MS Wellness Clinic with Professor Giovannoni and Dr. Turner. So here we're trying to get to people that have recently been diagnosed with MS and give them very early advice and education about fatigue management first and role maintenance, the things we were talking about, especially work. There are statistics that say that 70 to 80% of people diagnosed with MS are unemployed within 5 years of their diagnosis, which is quite a lot. Of course, that has huge implications for quality of life and work. There are studies that show that those of us that are working and feeling like we have a productive role in society can report that we feel to have a better quality of life and wellness. And also economically, just to have people maintaining those work roles. We do cognitive screening and mood screening, again, because those can have an effect on that idea of wellness. And basically, we're using patient-reported outcome measures, which is kind of a buzzword around health right now. That means things like, in particular, something that we call the Canadian Occupational Performance Measure, which is just an interview where we can take a big, broad idea like wellness and individualize it to you and assign numbers and data to it and help us to use it to track change and see if we're meeting goals. So it's basically taking a really sort of qualitative, fluffy idea like wellness and trying to turn it into numbers. That's what we're doing in the clinic. In terms of what we can maybe do with that data once it's collected, and it's not yet, it's in the very early stages, maybe we can take more advantage of the technology that's at our fingertips. Maybe instead of bringing people all the way across town just to come see me, I can sit and have sort of like a video conference with them. I don't know if anybody here uses Skype. I use it quite often to talk to my family back home, and you just need a laptop and an internet connection. You see a picture of someone, you have a face-to-face conversation with them, and you can give advice and education that way. It gives you a choice in deciding when and where that intervention happens. So this could also shift where therapists are based. So a lot of us are very hospital-based right now, and there's a big push to get more of us in the community and out where you all are, not having to bring you to us and having us come to you. that requires more bodies and more money, always more money. And then also, a lot of groups are going on currently with a lot of the organizations that focus on people with MS, but to have therapists and clinicians that can lead sort of an educational session in a time that's convenient to you all, maybe after work or even on a weekend, and talk about things that are important to you. You can be around people that are having the same types of issues that you are, and provide information and education that way. That's really all I have to say.